guys, I am Ahmad Haitham and I'm going to be talking about the Hepatitis B serology today. Now this topic is quite easy, but it's also one of the most important topics, especially for if you're planning to do any boards like USMLE or whatever. So let's get started. So first let's talk about the different antigens and antibodies which are present on the hepatitis B virus. So first you have three different antigens which are present, which are the hepatitis surface antigen, the hepatitis E antigen, and the hepatitis core antigen, okay? So the surface antigen, as you can see here, is present on the outside, and when this shows up on blood work, it basically means that the patient is actively infected with hepatitis B virus. The hepatitis E antigen, which is this one here, as you can see, it's inside the capsule of the hepatitis virus. So this antigen will only show up on blood work if the virus is actively replicating and it's shedding its capsule to release this antigen. Okay, and the presence of this antigen basically means that the virus is actively replicating and it's very transmittable. For the core antigen, it's not really important. What's important is the core antibody. So there's three different antibodies for each of these antigens. You have the hepatitis the surface antibody, and the surface antibody basically means that the person has either recovered from hepatitis B or they have been vaccinated against hepatitis B, because when they vaccinate people against hepatitis B, they basically give them the surface antigen and nothing else, so it will lead to production of the surface antibodies. For the hepatitis E antibody, now we said the presence of the E antigen means it's highly transmittable. But when your body starts making antibodies for the E antigen, it basically starts making E antibodies. This means that the virus is not very transmittable, so low transmittability. Okay. Then finally, you have the core antibodies. Now there's two different types of core antibodies, the IgM and the IgG, and they basically indicate the status of the infection, if it's acute or chronic, as we're going to see in the graph next. So you might have seen this graph before. It's very famous, and basically let's go step by step. So first, the hepatitis surface antigen, as you can see here, starts being detected after about 1 month of exposure up till about 6 months, where your body will start making the surface antibodies, and the surface antigen is basically gone from your body. So from this point up to about this point, you can say the person has an infection of hepatitis B, an active infection. But beyond that, the person has basically recovered from hepatitis B. Now, as you can see here, between the two here, there's something called a window period. Now, the window period is basically a small period where neither the surface antigen nor the surface antibody is detected. And so people might mistake it for the person not having hepatitis in the first place, but the only thing that will show up on blood work is the core antibody. Now remember, we talked about the core antibody and we said that there's basically two different types. So first, your body will start making IgM antibodies. Those are for acute infection, and then after about 6 months or so, it will class switch to IgE, sorry. So basically, the presence of IgM in the blood means it's an acute infection, while the presence of IgE means it's a chronic infection. Okay, then finally we have the E antigen and E antibody. So as you can see here, from this point up until to this point, the E antigen is detected in the blood, and this means that the virus is very transmittable to other people. Okay, it's very contagious at this point. However, about when your body starts making the anti-E antibodies, this means that the virus is not as transmittable as before. Okay, so let's look at a few examples of some questions you might see. So this woman comes in with hepatitis-like symptoms, and they order a hepatitis panel for her. So right off the bat, you can see here that the surface antigen is positive. This means that the person has an active infection of hepatitis B. This should be the first clue to knowing what the status of the patient is. Okay, so whenever you see the surface antigen is present, this means it's an active infection. Now, the surface antibody is negative, so the patient's body has not yet started responding to the virus, so they have not yet started making the antibodies. However, the core antibodies IgM are positive. Okay, also the E antigen is positive, and also the hepatitis A antibodies are positive, but this is kind of insignificant. We're mainly focused on the hepatitis B. So we've established that it's an active infection, and we also established that it's an acute infection from the IgM antibodies. So the answer would be A. Okay. So the patient is seen 2 years later for treatment of gonorrhea, and they order a follow-up hepatitis panel. So again, right off the bat, you can see here the surface antigen is positive, which means it's an active infection. The surface antibody is negative still. Okay, and the core IgM is negative. However, the total core antibodies are positive. So you can tell from this question that this person has moved on from the acute phase and is now in the chronic phase, because the IgM is negative. However, the total core antibody is positive, which means the person is now making IgG antibodies, which means it's a chronic infection. Okay. So finally, we have the last question here. So fourth-year medical student sustains a needle stick patient from a patient being evaluated for jaundice. Okay, so as you can see here, the surface antigen is negative, which means the person has either recovered or is vaccinated. Okay. So they do not have an active infection of hepatitis B right now. Okay. The surface antibody is positive. The IgM is negative, and the total core antibodies are also negative. And you also have the hepatitis A antibodies are positive. Okay. So as you can see here, the person does not have the active infection of hepatitis B. However, they have surface antibodies, and they do not have core antibodies. Okay. So in this case, you would say the person is vaccinated against hepatitis B and A, because in this case, why did we not say it's a chronic infection? Because the person does not have any core antibodies. And remember, we said the core antibodies are usually always detected in the late phase, or they will always be present. So the absence of core antibodies basically indicates that the person was not actually infected with hepatitis B, but however they were vaccinated against hepatitis B. And that's all for this video. If you want more details, you can check out more resources, and please solve as many questions as you can, because that will help you understand the concept better, especially for this topic specifically. Okay, thank you.